Alright, so welcome back. We are in physical examination room. So I am now going to perform my physical examination to you, so that I want to get a further information regarding your respiratory problem. Okay, so right now, so I will do some physical examination regarding your respiratory symptom. Okay, so before that, I will position you correctly. If you are comfortable with sitting down, you can sit down. Okay, so I will hand rub. Okay, so at first I will observe the patient under a good lighting, and I will expose the body, and also I'll compare between the right and the left. Okay, so as my inspection goes, I saw a patient is in there is no chest restriction, there is no use of accessory muscle, and then there is no apex beat visible. Patient is not in tachypnic condition. There is an equal chest movement of bilateral chest, and also patient is currently quite comfortable. Okay, so I'm going to proceed with palpation. Okay, so I get my hand rub. Alright, so can you please bow down a little bit? Okay, alright, so I will do my palpation over the anterior region of the chest. First over the left side, so I will touch, and I will ask patient to say 99. Can you say 99?
99, 99, 99, 99, 99, 99.
Okay. Now I will proceed to the back at the posterior region.
99, 99, 99.
Okay, sir, can you please move here? Okay, so I'll repeat back over the left side.
99, 99, 99, 99, 99, 99.
Okay, so I will move to the lateral. Sorry.
99, 99, 99.
Alright, so I'll move here.
99, 99, 99.
Alright. Okay, so as far as I can feel, the patient right now have no tender, there is no trail signs, normal transverse diameter between posterior and anterior and posterior chest. So I've used tactile vocal pharyngometer, so I asked the patient to say 99, and also I saw there is a normal expansion between the right and the left lung. Okay, so let's go to percussion. So I will percuss on over the back first. Okay, please move to this side. Okay, move to this side. Okay, bow down a little bit. Okay, alright. So I will percuss over the intercostal space, every intercostal space from the anterior to the posterior to the lateral, bilateral, lateral, and also the chronic isthmus. Okay. 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 So can you lift up here? Like this? Okay. Okay, move to this side. Alright. Now, okay, sit down. Okay. As for my percussion goes, I heard a normal tympanic sound. There is no subtympanic sound available. There is no hyperresonance, and no impaired sound between right and left over the lateral, and also the chronic isthmus, and also there is no dullness. So meaning the chest sound from the percussion is quite normal. Okay, so I will move on to auscultation. So I auscultate the patient. Okay, first I auscultate the anterior. Okay, breathe in, out, in, breathe in, breathe out, breathe in, out, in, out, in, out, in, out. Okay, so from the lateral, in, out, in, out, in. Okay, from this side, in, out, in, out, in, out. Okay, now from the back. Okay, can you please bow down, down. All right. Okay, in, out, in, out, in, out, within, out, within, without, within, without, within, without, within, and without. Okay. Okay, so from my auscultation, I hear a normal sound of the respiration. So the air entry is equal over the right and the left. There is no crackle sound. There is no crepitus sound. I can only hear patient have a little bit of rhonchi over the middle zone of bilateral lungs, but there is no crepitation, there is no real sound, there is no sternal rub sound. The air entry is equal, and also the patient is not having any tachypnea during the auscultation. So Mr. Shazwan, what I can conclude from my physical examination, there is a few things that you might have right now. So probably your symptoms shows you have a bronchial asthma. It's either a bronchial asthma or you may have an acute pericarditis. This is because of your previous hospital admission before to the emergency department, because they say in your chest x-ray there is a little bit of pericardial infiltration. So I suspect probably you have an acute pericarditis, or you might have a pulmonary tuberculosis because of the length of your symptoms. You say it was already 2 to 3 weeks, so you might have a pulmonary tuberculosis, or you might have pneumonia, which is an infection to your lung, or you might have another symptom which is called tuberculous pericarditis. So it's a combination between tuberculosis and also pericarditis. But I cannot confirm or deny your diagnosis yet without laboratory investigation and also radiology investigation. Okay, so after this we will proceed with blood taking, and also we will do some chest x-ray to see how is your condition. Okay, all right, so I will end this examination. Thank you.